Sometimes your patients don't actually understand why. For example, there was this patient, I told him that your blood pressure is skyrocketing.com anytime, any place. He said, I really don't want to start these medications because my friend has them and this happens to him and he has to get this done, these blood tests done to check to make sure that his kidneys are fine, this, that, and the other. It took me 2 good appointments to try and convince him that he needs to be on these antihypertensive medications. First appointment was where it was incidental that his blood pressure was high. Then obviously you need to do the ambulatory or the home blood pressure monitoring, and then you assess that and then you decide whether to start them on antihypertensives. I saw him after, the ambulatory one, I think he did, and I said to him, yeah, your blood pressure is still really high, you need to start antihypertensives. And he was just like, no, my friend said this, my friend said that. I said, you know what, I'm gonna hear you out. What is the issue? He explained in detail why he didn't want to take it, and I said to him, look, the reason why we worry about high blood pressure is because of what can happen. I feel like when they hear and understand the logic as to why we want to start them on medications if we need to, that will help them to understand why and maybe convince them to. I said we worry about blood pressure being that high because you can get strokes, you can get heart attacks, you can get AAA, you can die. Literally, sometimes you have to say the words, you can die because of your high blood pressure. And then when he understood, he was just like, do you know what, actually, okay, fine. Kind of sounds like maybe I do need them, because I can't be rolling around with my systolic above like 160 just on a day-to-day expecting nothing to happen. After that conversation, he took it, followed him up with his antihypertensive, because you need to do some blood tests sometimes, for example, if you're on Ramipril. And yeah, doing fine now. Sometimes they just need the rundown. I feel like that helps with compliance, right?